Will the First Minister make a statement on the provision of mental health services in North Wales?
Yes, improving mental health services across the whole of Wales continues to be a priority for the Welsh Government, and we've committed a further £40 million specifically for mental health services over the next 2 years.
Thank you, First Minister. I have previously raised with you my immense concerns on behalf of my constituents about the current mental health provision in the Betsy Cadwallader Board in North Wales. Last term, I referenced correspondence from Professor David Healy, who is a widely respected consultant psychiatrist in North Wales. At that time, he raised issues around staff morale, suitability of staffing arrangements, the exit of senior nurses from the service. Now, again, a recent letter that I've now received a copy from Professor Healy to the Cabinet Secretary raises further concerns and notes that following his visits to some mental health services within the Betsy Board, in his words, in the August unit, he was presented with a scene from Dante's Purgatory, or Hell. On arrival at Roslin Mental Health Centre, he found an equally apocalyptic scene. Now, this theme correlates directly with constituents' views when they come to see me, needing this desperate support. He finishes by saying, you now have every locum in the UK steering clear of here and patients finding themselves in settings unimaginable a few years ago. It's an extraordinary fall from grace. Now, this service, First Minister, is failing and was in fact the primary trigger for the special measures being put in place. Now, 2.5 years later, this service is in a mess. The response from the Cabinet Secretary shows disinterest. Now, will you take this matter seriously? Will you take this? I have your response here.
Just the question to the First Minister. Don't get diverted.
I have the letter to Professor Healy. I have the response. First Minister, I would like to share these with you. But I am asking on behalf of my constituents, on behalf of the staff who work in these units, will you please look at this service more carefully and actually maybe have a conversation with the Cabinet Secretary and perhaps just get him to show a little bit more enthusiasm and concern when issues of this nature are raised about mental health services in North Wales.
I think it's hugely unfair to suggest that the Cabinet Secretary is not concerned. He is somebody who is passionate about the health service, and that certainly is not the impression he gives to the public, that I'm sure. I am aware that the member has written to the Chief Executive of the Health Board with a number of concerns about the provision of mental health services in North Wales. We have asked the Chief Executive of BCU to meet with you in person as soon as possible to discuss your concerns. In terms of the comments around the operation of Conway Community Mental Health Team, I know that the Chief Executive and Mental Health Director met the Local Authority Scrutiny, or met rather, the Local Authority Scrutiny Committee last week to discuss concerns and action directly with them.